Well, hey, everybody, welcome back to Client Side Chats. We have another special guest with us today, Letitia Heshmat. Letitia is the founder of Mobilemet. And hey, Letitia, welcome to Client Side Chats.
Thanks for having me.
Glad to have you here. Hey, and as a reminder for everybody, don't forget, you can find us on our Facebook, LinkedIn, our Vimeo, and YouTube channels as well. So having said that, Letitia, how are things been going for you as we jumped into this whole COVID thing? I know you and I had been talking back and forth briefly and kind of discussing each other's business and everything, but how have you guys fared? How's things going?
It is an interesting time for all of us, certainly. It's a busy time for health and safety, as you know. And we're really just taking it day by day, making sure we stay up to date on the most recent changes, what it is that our clients need and may need implemented. As it varies in industry and region, we're talking to clients that are nationally now. And so, COVID is going to be completely different from location to location, and then on a global scale as well, what that's looking like depending on the location and the industry that the client's in. So it's a really interesting time. We're definitely busy.
And hey, tell everybody what it is that your company does.
So Mobilemet is an on-site occupational health provider, and we started on the West Coast 3 years ago, providing mobile services as Mobilemed, on-site flu shots. The idea was to have medical surveillance, but very quickly that morphed into doing on-site and near-site clinics as well. So we provide occupational health and wellness for large employers, and kind of take the approach that there's not a cookie cutter approach to on-site occupational health. Not everyone needs a 5-day-a-week clinic. There may be employers that need telemedicine, employers that need a 2-day-a-week clinic. And so we really create a customized platform for all of the employers that we work with, and help them with their on-site occupational health needs, whether that be workers' comp, surveillance, preventative programs. So we do the health side of health and safety. But as most everybody else did, we had to take a quick pivot with COVID. A lot of our sites were not essential workers, and so they were shut down. And a lot of our clients came to us and said, for our essential workers help, we need programs. So we pulled in some other resources that we have and created programs, and now we're one of the largest providers of COVID support to employers of all sizes.
That's fantastic. I know this has been one heck of a change, and you and I were talking a little bit about business prior to us doing this recording, but kind of give us an idea. I know we've worked together, but kind of give us an idea of how employers you see, how they're approaching it. I know we talked about the idea of layers. Is that correct?
Yeah.
Yeah.
So I liken COVID safety in the workplace to be like a day in San Francisco, a Bay Area native. Like, you need to layer on those clothes because the weather can change at any moment. So for me, it's, I'm seeing that everyone does a different amount of layers. All of the employers, it's depending on their geographic location, depending on their exposure. But you kind of have, the base layer, which is they started with social distancing and a lot of working from home, and just virtual work where they could distance everyone from one another, and making sure PPE and sanitization practices were up to par and where they needed to be. And that was kind of just the base layer. And then as employers did start to open up, and for the essential workers, temperature monitoring was a huge thing. And so we have programs with temperature monitors for employers, but we saw the need to move to thermographic imaging. And you can be a lot more cost effective with one employee and some thermographic imaging, or just a thermographic imaging device, as opposed to the more manual, labor-intensive or not as cost-effective ways of having temperature monitoring on site done by someone. So that's kind of another layer. And then we have groups that ask that we pass out PPE. And so that's kind of another layer of work that we'll do with employers. Another thing that we see very frequently implemented are just like COVID support. So employers that have been thinking about having an on-site clinic or having some telemedicine, and now employees are nervous about getting back to work. And, it's a heightened time, as with stress and, wondering if this person's, just sneezed. God forbid you sneeze in the building, right? Like, it could just be allergies. And if you sneeze, it's just everyone's radar goes up. So I think having an occupational health provider, having a nurse on site, in some cases an EMT, just to be able to give another level of support, and be able to answer some questions, or something that we're seeing a lot of employers are moving to, and to have some, just give them a little extra confidence in being in the workplace. We have surface testing. So some employers want to make sure that the testing that they're doing, the cleaning that they're doing, is really effective. And so we do randomized surface testing, and send those surface swabs off, to see if there's any trace of COVID, and if maybe anyone needs to up their sanitization practices with their janitorial staff, or whoever it is on site, and they need to up that a little bit. So that's another thing that some employers are doing. And then lastly, you have a gamut of testing. Everything from baseline testing, which is, for some healthcare workers and skilled nursing facilities, that could be weekly or monthly. With other employers, they want to offer testing as a wellness. Just, if you'd like to have testing, here's someone available that can do testing for you. The gold standard is PCR testing, or it's a nasal swab. Luckily, we've kind of advanced, so we don't need to do that brain tickle right all the way back, which is not fun for anybody. So we do the nasal swabs, and that's sent off to various labs that we're contracted with, and we can provide testing on site for that. Some companies still like antibody testing, and they like to use that as another layer, so those are options as well. And there's rapid antibody tests. And a lot of people ask about turnaround time for testing. It's typically about 48 hours now. In August, we've seen a much better turnaround, where July, there was a bit of a bottleneck, and there were some issues with testing and timely testing. And then lastly, there's rapid tests as well. So there's machinery that you can have on site, in the company, to be able to turn those tests around in about 15 minutes. So there's definitely a layered approach, and companies are doing different things. Not to mention the questionnaires and self-attestations. And I think a really important part that ties that all together is, when you do get a positive, what do you do with it? So there's a lot of vendors, or companies that I'm hearing. I'm working with a vendor and they told me that I have a positive, or they help me with testing and I have a positive. But from an occupational health standpoint, what do I do with that positive? And a lot of people don't have the AHS staff or the occupational health provider on site to tell them how they may need to handle that. And so, that's an additional layer of support that some companies are really needing right now. So it's definitely varied, like you said, per industry, per location. But we try to find the best method to support them in whatever way we can.
Oh, this is great, because I know a lot of people have been struggling with that idea. How far should they go? What should they do? What can they trust? And I know you and I have had many conversation via text and phone calls and things like that regarding those kinds of things. What do they trust? How do they know? And all the different things. And certainly it's been a great resource. Oh,
Yeah, and the follow-up.
absolutely.
So now
Yeah.
I have a positive, I have to do the contact tracing. And how do I do that? And so we have a COVID module that has the questionnaires that you can input, your testing input. You can put various surveillance panels where they can schedule their employees to be tested at a certain period of time, whether that be 7 days, 30 days, etc. And then they can also do their contact tracing through the system. So really a good platform to be able to tie that all together. We use Channel 19 with Enterprise Health, and they've been really helpful in helping us kind of streamline all of that. So having a platform to be able to tie that all together is really important too.
That's great. That's great. So, well, Letitia, we're running out of time here, but thank you. And I should say doctor, by the way.
Oh, no
So
problem.
anyway, so my apologies here. I didn't mean to be disrespectful, but
Not at all.
let's have you back on really quick, to kind of see how it's going, because things are rapidly changing. And I think it'd be interesting to our audience and audiences out there as to all the different kinds of things, because they hear a lot of different information. And I know it's very helpful to hear it all consolidated into one. So,
certainly. And maybe we can stop talking about COVID and talk about occupational health, which is the core of what we do. It would be nice to move on once, right? I feel like my inbox and my entire life is COVID. When are we going to get to stop talking about COVID?
I think everybody feels that way today. So, all right.
Yeah.
Thanks, Letitia. Thanks for joining us.
Thanks for inviting me. It was a pleasure chatting with you.
Same here. And we'll talk again soon.